Today we're going to be talking about addiction, which is a very, current topic considering, the increasing rates of addiction in this country in particular. So yeah, we're going to talk today a bit about the science behind addiction and also some of the ethical issues surrounding it.
Okay, so what does everyone know about addiction already? Maybe anything changing in the brain, any kinds of addiction, what are the most common types of addiction, if anyone knows? And yeah, for anyone who's new to this, are some addictions positive? Are some negative? Does anyone have any ideas? What kind of addictions exist? Just feel free to put any ideas in the chat. Any ideas? What kind of addictions exist? What do you think? Substance abuse, yes, that's a very common one. When you mean substance abuse, so there's quite a few types of substances that can be abused. Can you think of any? So one, for example, would be alcohol. What other kind are there? Opioids, yes, less common than alcohol, but any other ideas of substances which can be abused? Marijuana, yes, that's true. Nicotine, yes, that's a very, very common one. And where is nicotine most commonly consumed? Or how is it most commonly ingested by humans? Smoking, yes, exactly. Okay, right, I think, is it through injections? No, it's through smoking. Yeah. Okay, so we're gonna start, we're gonna talk about addictions now, and thank you for the suggestions in the chat. Addiction is defined as not having control over doing, taking, or using something to the point where it could be harmful to you. And that's the definition given by the NHS. Clinically, it's defined as a disorder. It disrupts regions of the brain responsible for reward, motivation, and judgment, causing people to compulsively and repetitively use substances or perform activities despite their negative impact on health. Although most commonly associated with gambling, drugs, alcohol, and nicotine, which I think we got 3 of those there, it is possible to become addicted to anything. Other common addictions include work addiction, internet addiction or mobile phone addiction, solvent addiction, and pornography addiction. Can I please just remind everyone to please turn off their microphones unless they'd like to add something, in which case, please feel free to use the chat or ask us for permission to, say something out loud and we will happily grant it to you. Thank you. Yeah, Javas?
Yeah, so we're going to carry on now and talk a little bit about how addiction affects the brain. So all types of pleasure, including getting a present, eating a meal, or even having a sexual encounter, involve the release of the chemical dopamine in the nucleus accumbens in the brain. So this is, you can see on this diagram where it's located just below the prefrontal cortex. And so you may have heard of dopamine before. It's often called, the pleasure chemical because that's what it does. It's released in the brain's pleasure center as well. And these activities, such as eating and sex, they're linked to reward by dopamine. And this is because these activities are needed for human survival. And we've evolved to release dopamine when we consume these things because that helps us to survive. Strong drugs such as nicotine, heroin as well they cause powerful surges in dopamine production, which provides a shortcut to the brain's reward system. And the hippocampus remembers this burst of satisfaction if an addictive drug is consumed. So you can see the hippocampus here just below the pleasure center of the brain. So repeated exposure to an addictive substance causes the brain to link liking something with wanting it, and this causes addicts to involuntarily be drawn to consuming the drug over and over again. Over time, the brain becomes overwhelmed by the increased dopamine and less of the chemical is released. This can be likened to turning the volume down on a loudspeaker when the noise is too loud. So the brain will start to control it to ensure that too much dopamine isn't released. Drug users will then often resort to taking more and more of the drug in order to achieve the same high, which can lead to severe damage to their health. So that's just an overview of addiction, and that shows how drug addicts, or people who are addicted to any substance, can have their health deteriorate through increased consumption, and how eventually it doesn't become something they control. It's something that is ingrained into their minds, and that's one of the reasons why addiction is so dangerous.
Yeah, so we were talking about these types of addictions just before. Can anyone discuss with us, feel free to put answers in the chat, regarding smoking and alcohol? What health issues can smoking and alcohol lead to, especially when a mother or an expectant mother is pregnant? So we did discuss this in a previous session, our pregnancy session, which you'll be able to find on YouTube. But just for now, can anyone think of what issues smoking and alcohol can lead to? Yes, embryo death, or even death of the mother in extreme cases. Fetal alcohol syndrome. Yes, that's a really good answer. Which I think Shivas, do you want to explain that in a bit as well? Exactly what fetal alcohol syndrome is. Any other ideas? Think about maybe not just if the mother is pregnant, but let's say really, really very close to the due date of the baby. Underdevelopment of the embryo, low birth weight. Yes, that's a very good answer as well. Yes, so I think we've pretty much covered that there. Placental problems, yes. So Shivas is going to cover it now. Yeah, but I think we have quite a good range of answers there.
Yeah, so we've got on the screen here some of the consequences of smoking and alcohol. So smoking whilst pregnant has been linked to an increased chance of miscarriage, premature birth, breathing difficulties, and of course nicotine can have a drastic effect on the baby's lungs and brain. And alcohol, as someone correctly mentioned, can pass through the placenta and cause premature birth weight, low birth weight as well, and also fetal alcohol syndrome, which someone else mentioned. And we can see, on the right here, some of the physical characteristics of people with this condition. It can lead to, malformations in, people's physical appearance, but also it can link to poor social skills, difficulty hearing, difficulty eating, and other mental handicaps as well. And it may result in children needing medication or specialist educational support for their entire lives. And that's, part of the reason why it's so risky. So yeah, we're going to move on now and talk about a little case study to do with smoking and alcohol.
Yeah, so this case study is related to the smoking and alcohol addictions we've been talking about. And you can read along with us, but feel free to skip ahead if you wish to. One of your patients, Julia, age 29, is in the 3rd trimester of pregnancy. She tells you that the pregnancy was unplanned, but she did not want an abortion. Her husband and the father of the child passed away a month ago from a heart condition. Julia tells you that she still drinks alcohol regularly and that this helps her cope with the situation. When you tell her about the potentially disastrous effects this could have on her child, she tells you that her sister drank during her pregnancy and her sister turned out fine. You recommend some specialist alcohol advisors to her, but she becomes angry and tells you that she does not want any help. So in this case, what exactly is the problem? What would you do if you were the doctor in this case? And should doctors respect their patients' wishes if they refuse for their addiction to be treated? Now, there's lots and lots of ethical problems at stake here, and I'm just going to throw these out here. So, first of all, one major ethical problem or ethical sort of controversy. Should the expectant mother have the right to do whatever she likes during the pregnancy? Should an expectant mother be able to consume any products, including alcohol, including any potentially harmful substances and potentially addictive substances? Should the doctor be allowed to say anything in this respect? Is the baby's consent being taken into account? Obviously, the baby can't consent, but obviously that's an important factor. And how do we overcome this, if at all? So what does everyone think? Please feel free to put your answers in the chat. Yeah, just whatever your thoughts are. Okay, so someone said, ethically, mother's decisions overruled. Okay, why? And does everyone feel this way? Does everyone feel that, the pregnant mother should be allowed to make all her decisions and that they should overrule all medical decisions or advice? Well, if we link it to the beneficence pillar, we should restrict her substance intake. Okay, but then doesn't that clash with what the person before you just said, that the mother's decision overruled? And what pillar is the mother's decision referring to? And you said if we link it to the beneficence pillar, we should restrict her substance intake. How would you do that, and how would you monitor that? Because you can't exactly keep the mother in the hospital for her entire pregnancy. Any ideas? Feel free to disagree with me. Feel free to agree with me. There's not, this is an ethical question, so there aren't right answers when we're talking about this. Or wrong answers. Not keep her in the hospital, but maybe have a midwife periodically check on her home environment. Okay, that's an interesting idea. Do you believe that might be intrusive on her privacy, or do you think that's, do you think it's maybe not intrusive enough? Maybe it should be maybe not just a midwife, but a doctor and a midwife. And maybe rather than just checking up periodically, maybe tests should be done, perhaps. Someone said, and support her through her grievances. That's a really important point. I think, yes, especially with obviously autonomy is very, very important. And if someone is feeling grievances about not being able to smoke or drink alcohol, the NHS and the healthcare system should be there to support these people, support anyone who's pregnant through their grievances about this. Any other ideas? Think about maybe think about ideas like, if the mother is completely refusing to control her alcohol intake, what could possibly be the way to show her that, this isn't, maybe her sister got lucky when her child, her child was completely unharmed. However, it's not always the case. It's fine if you don't get it initially, or if you don't understand it. It is a difficult question, and we're not expecting anyone to have the perfect answer. Not that there is one. But while you guys are coming through that, maybe we should move on. And if anyone has any ideas, please feel free to put them in the chat throughout the presentation and the PowerPoint.
We've got another case study here, which is a little bit similar, but it's about reporting drug users, which is something which has come up in a few news articles recently, and especially whether it's a doctor's role to report drug users to the police, for example, or whether they should objectively just try to treat them. So we've got here Anna, a 43-year-old single mother, comes into your hospital with her 17-year-old son Rocco. Anna complains of pain in her abdomen, so you take her to the radiology unit to undertake the CT scan. Whilst Anna is undertaking the scan, you notice bruises on Rocco's arms. You ask him about them, and Rocco tells you that they are from his mother. He tells you that she is a daily meth user, and when she gets high, she often becomes angry and violent. Rocco tells you that he has to hide from her when this happens, and that he usually has to buy and prepare food for himself and his mother since she is unable to do so. You immediately become concerned and tell Rocco that you are obligated to contact social services. He begs you not to, and he is worried about being forced to live away from his mother in a foster home. he also worries that his mother will be sent to prison. So first of all, what would you do in this situation? Would you do anything in this situation? Would you just treat the mother and then allow them both to go home? Or do you think that your role in this situation should go past that? Do you think that as a doctor you should actively try and influence Rocco's living conditions, try and secure social services arrangements for him, try and ensure that he lives in a foster home, even though that's not what he wants? Which ethical pillars as well are in play here, and therefore which decision would you make? And then we've got more of a general question: should a doctor have a say in legal situations regarding their patients? So yeah, what do you think? We'll give you a couple of minutes just to think about that, and perhaps put your answers in the chat.
Someone said yes, but the doctor cannot make the decision for her.
I don't know if that was referring to the previous case study, but if it was about this one, then that's true. Well, in this case, a doctor couldn't make a decision in terms of what was happening to Rocco, what was happening to these living arrangements, because it's not a doctor's job to do that. Someone said, I think a doctor should have a say when it affects the patient mentally as well as physically. Okay, that's an interesting point of view. So a doctor's role, as we know, is to do no harm, to ensure that patients have a good quality of life, and that not only includes their physical well-being but also their mental well-being. And in this case, it would be beneficial for perhaps both parties' mental well-being, both Rocco and his mother, to contact social services to try and ensure that Rocco has a good quality of life, that he's away from his abusive mother, and that Anna is getting the treatment that she needs. And someone's added, it seems there's an obligation to report suspected child abuse. Okay, that's true, but also consider the pillar of autonomy here. Do you think that we should do that, considering it's not what the patient wants, not what Rocco wants in this situation? Someone said, in regards to justice, doctors have a moral and legal duty to people who are in emotional pain or infirmity. Okay, that's very true, and that's links on to the point above. But do you think that a doctor's role to improve a patient's quality of life and to help patients who have emotional pain, should that supersede a patient's autonomy? Any ideas? Okay, someone's put, well, technically no, because it would invalidate assisted suicide. Okay, that's an interesting point. Could you explain that a little more, perhaps? I don't quite understand what you mean. So you think that if a doctor didn't do anything, that could count as assisted suicide? That's means that a doctor isn't fulfilling their role to help patients, and therefore they are playing an active role in harming a patient. Someone said, when you asked if the doctor could do something that goes against the autonomy of the patient. Okay, oh, I see what you mean. Okay, well, that's an interesting point, and that's the main dilemma that we have here, whether we should respect a patient's autonomy, or whether we should try and fulfill a patient's wishes, and ensure that a patient has a better quality of life and a better outcome. Someone said, in one aspect, allowing autonomy might contradict benevolence and non-maleficence, especially to a minor. Yes, that's very true, and that's, as I said, the dilemma here. I think in real life, what would happen is that if there was evidence of serious abuse or serious harm that was coming to this child, then it would be a doctor's responsibility to report that. However, a doctor would work with the patient, work with Anna, work with Rocco to ensure that both of them understand what's going to happen and try and work out the best outcome for both of them to ensure Anna gets medication to see perhaps whether she could be still eligible to raise Rocco whilst on medication perhaps and whilst attending rehab or something like that. So, and or perhaps Rocco could live with a family member. Although it wouldn't be a doctor's role to organize this, it is their role to reassure patients and show them all the possible outcomes that are available. So, yeah, I think that's what would happen in a real life situation. I think perhaps we should move on now to the next case study. And I think this is a real life case study. So, yeah, sit down if you go through this one.
So this is the Regina McKnight case. I hope I'm pronouncing that right. And it reads like as follows. In 1999, 31-year-old Regina McKnight from South Carolina, USA, gave birth to a stillborn baby who later tested positive for cocaine. In 2001, McKnight admitted to having a cocaine addiction during pregnancy and was convicted of homicide by child abuse. She was sentenced to 12 years in prison. In 2008, the state Supreme Court overturned the conviction due to insufficient evidence. McKnight instead pleaded guilty to involuntary manslaughter. She was released later the same year. McKnight told reporters about how she struggled in jail and was forced to miss out on 8 years of her three other children's lives. She was unable to care for them and had been victimized and abused before her pregnancy, causing her to turn to drugs. After being released, she swore to never take drugs again. So the questions as follows say, should women be allowed to take drugs, drink alcohol, or smoke whilst pregnant? And I know we discussed this in a previous slide, but think about this. So is the autonomy of the mother the most important, or the health of the baby? Which is a huge ethical problem, ethical concern. What does everyone think in the chat? Please put your answers in the chat. And should the parents of a baby born with a condition such as FAS be punished of any sort? Does anyone have any ideas? So, by the way, FAS stands for fetal alcohol syndrome, just in case. Yes. Does anyone have any ideas for this slide, for these questions at the bottom?
And also regarding the first question, it might be worth considering if your answer is no, then who should make that decision? Should it be the government who decides whether women aren't allowed to take drugs, alcohol while pregnant? And how does that impact patients' autonomy? Or should it be medical professionals on a case-by-case basis? So that's quite a broad question, really.
I think. Sorry, could you explain the point? It says, I think they criminalized a mental disorder. I think they criminalized a mental disorder. Shivas?
I think, do you mean that it's a criminal offense to be pregnant whilst having a mental disorder? If so, I'm not quite sure how, whether that's the case.
Can I just elaborate?
Yep.
Yeah, because if you describe addiction as a mental disorder and criminalizing someone for having a said mental disorder, it's kind of like taking away from, it's kind of contradicting each other. So that's what my point was trying to say.
Okay. In that case, would you argue that, for example, obviously consuming cocaine, because it's a controlled drug, that's illegal. Would that now supersede the point of it being an addiction and therefore possibly being argued to be a mental disorder being criminalized? It's the fact that she consumed cocaine and possessed cocaine, which was criminalized.
Yeah, because I think that if she was able to stop taking alcohol and stop taking drugs, she would have. But the fact that she has such a mental constraint because of the drug, that's might have caused her to continue taking it during her pregnancy.
I see what you mean. I mean, so you're saying because it's not really a choice, it's kind of a compulsive decision that's, patients are continuing to take these drugs. They don't really have a choice over it. Therefore, it should be classed as a mental disorder and it shouldn't really be punished as such.
That's an interesting viewpoint, yeah. Someone said, I think the autonomy of both is important, but because drugs do not improve the health of either and they only provide a temporary high, the autonomy of the baby should be prioritized. That's a really well thought out idea, because of the fact that if something that the mother is feeling compulsed or compelled to use because of an addiction, um, for example, cocaine or alcohol, because it's not helping either the mother or the baby, it's possibly more important to just quit it, because considering that because it doesn't have a positive effect or any health benefit to the mother or the baby, then it should the health of the baby supersedes that, and obviously the baby would not want to be unhealthy before being born, surely. So it's a tricky debate that sometimes the autonomy of the mother counts more, especially if they're the one that's taking care of the baby, and they're the one that, you know, have made this huge sacrifice to take care of the baby, and they're probably already controlling a lot about their diet and food intake already. It probably makes sure that you know, they're probably making sure to do lots of things that are good for the baby as well. But again, it's a very, very tricky debate, and lots of it has lots of factors have to be considered. I think that's a really, really good, some really, really good suggestions there. I think we're going to move on now because we do have one or two more slides to go. But yes, really well done, and yeah, good points.
So we're going to talk a bit now about addiction and healthcare workers themselves, which is something we have considered a little bit before in this session, but it's something which I think is very important that we know about, and especially something which you could talk about in an interview for medical school, for example, about some of the issues that healthcare workers themselves face with regard to addiction. So 1 in 6 doctors in the UK face drug or alcohol addiction, which is actually quite a high number. And of course, this is higher than the percentage for people who aren't healthcare workers. They're actually more likely to develop addictions than people working in other professions. And this is often linked to the stress of working in a high pressure environment, and also other factors like limited sleep and free time, and them to control these things. And so, you know, obviously that's a very large issue, especially in healthcare, which is a services-based industry. It's to do with patients really caring for their patients. They have to have not only a good scientific understanding of the treatments they're providing and ensure they're making the right medical decisions, they also have to have a very good social aspect to their lives. They need to be able to communicate effectively. They need to be empathetic, sympathetic. And these are very hard qualities to retain when you have an addiction. And, you know, as it says here, addiction can drastically affect the ability for staff to work safely and professionally. And addiction can really impact their ability to concentrate and to make decisions. And this, of course, can lead to doctors making mistakes, compromising patient safety. So regarding this information, what do you personally think should be done to tackle this issue? Should we be trying to, you know, recruit more doctors, you know, to kind of ease the stresses on medical professionals? Or can you think of any other methods in which we can try and fix this issue? Do you think perhaps privatization of the NHS, or, you know, aspects of privatization could help solve this issue? Because then in that case, medical professionals could have better resources, more technology perhaps due to more investment, and that could again ease the stress on these people themselves. And also, do you think doctors who are drug or alcohol addicts should be banned from practicing medicine? Do you think if their ability to practice medicine is affected by these addictions, do you think they should be able to do that? And also considering the fact that, you know, doctors have very specialist skills and they can't be replaced very easily. Considering that, do you think it would be, you know, do more harm than good banning healthcare professionals from practicing just because they have an addiction which they can't necessarily control? So yeah, what do you think about these two questions? Please do put your answers in the chat. Someone said doctors should have access to counselling. Okay, that's an interesting idea. And you know, there are organizations which currently provide counselling, provide therapy to people who are who do have addiction, not just medical professionals, but all people. but perhaps it should be made, there should be more awareness raised about it in hospitals, in healthcare settings, so that doctors who have to often treat patients can be aware of that they might themselves need help and need treatment. So yeah, that's a very interesting point. Does anyone have any other ideas, maybe regarding the second question? Someone said they shouldn't be allowed to interact with patients if they are under the influence because they might harm the patient or themselves. Yeah, that's very true. And there have been lawsuits in the past about patients, doctors and surgeons who have made mistakes and then later found to be under the influence of alcohol, because it can affect their decisions, can affect their concentration, and therefore that can increase the risk of mistakes. So I think a lot of people will agree with your opinion there, but of course that means that other doctors will have to step up to take their positions. That will increase the strain on other professionals. Does anyone have any other suggestions? Siddhant, perhaps do you have any ideas that you'd like to add?
Sorry, for the first question.
For either, I think.
I think it's quite difficult because obviously a doctor's primary concern, especially on the job, should be the care of the patient and the safety of the patient. If people are addicted to alcohol, obviously that's going to impair the judgment and the ability to provide excellent care for their patients. Tackling it's a very big problem because that assumes that the problem can be solved sort of efficiently and in one or two numbers of ways, when obviously different people could be addicted for different reasons. Someone said they shouldn't be allowed to interact with patients, and I think I agree with that if they are under the influence, because they might harm the patient or themselves, especially if they're using very dangerous equipment. I honestly don't know how we could tackle this growing issue apart from spreading awareness with doctors or making sure that they understand that they might, maybe doctors believe that they will not harm the patient while it's under the influence and they're just harming themselves. But again, it's a very difficult thing to do.
Yeah, it is difficult, but I do think raising awareness is the single most effective thing that can be done. And I think that's something which the NHS in particular is trying to push towards. So yeah, thank you everyone for your comments on this slide. We've got one last slide, which is an interview question. And considering everything we've learned so far in this session, we'll have a go at answering it and seeing the points on either side. Considering the significant risks posed by alcohol addiction, should there be a total ban on alcoholic beverages? So first of all, let's consider the points for the motion. Should we ban alcohol? So does anyone have any points as to why you think we should have a complete ban on alcohol? Think about the effects that alcohol can have on pregnancy, for example, the effect it can have on medical professionals, all the stuff that we've talked about today. And please do put your answers in the chat. They can just be single comments, single sentences if you want. Okay, someone said they can cause chronic diseases, liver failure, and this will put strains on the NHS. So you've got 2 points there, really. They can cause, disease. They can have a really negative effect on people's health. And then you've got another point, more economic point. It can put strains on the NHS because obviously we'll need more money, more funding to be able to treat those conditions. And the NHS as a tax-funded organisation, it's not easy to raise the funds for those treatments without having a major cost to the public. Does anyone else have any other ideas? Someone said drinking doesn't always cause addiction. Yeah, that's a very true point. And the vast majority of people who do drink alcohol will drink it responsibly. And therefore, you could argue that it's a threat to autonomy if we're banning something when, as someone said, in moderation, it can have beneficial effects. You know, drinking is a very big part of culture, especially in this country. There is a big drinking culture, and drinking is ingrained into our society. You know, people often go out to social occasions to drink, and obviously that doesn't apply to everyone, but it is a you know, big part of our lives. And of course, the alcohol industry makes a lot of money. So um, that's one of the reasons against the statement, I guess. And someone said, um, it can relieve stress as well. Yeah, does anyone have any other points on either side of the statement? Perhaps either side, we either should or shouldn't ban alcohol. Someone said, I think addiction and problems caused by alcohol are due to lack of moderation. Um, okay, that's true. And so perhaps that's a solution to the problem. We shouldn't ban alcohol completely, but we should increase our moderation of alcohol. Um, we should have more services available to people to ensure that addiction doesn't become a problem. Because as you've mentioned, alcohol does have many benefits as well. You know, it can have some beneficial effects, and also, you know, there's an economic significance of alcohol as well. Oh, this is someone said an interesting point here. Food can cause obesity, but it's not banned. Yeah, and I guess that's mainly due to the fact that food is as an essential product. It's something that we need, whereas you could argue alcohol isn't. But you know, I understand the meaning behind your point. You know, food, you know, anything really can cause harm. You know, water can cause harm to people. Um, all foods really, all things that we can consume, everything when not in moderation can cause harm to you. And it's the same with alcohol, but alcohol's consequences can be particularly severe. But I understand your point. You know, we need to focus more on moderating alcohol use and consumption rather than banning it completely. And I'm not sure if anyone has read any news articles or studies regarding banning alcohol and you know the cases in which it's been tested, but often it doesn't work, and that's due to you know black markets arising, people you know selling alcohol illegally, and this often means it's of a lower quality as well, and the safety of alcohol isn't measured. Also, the the concentration of alcohol won't be regulated in those cases. So that could actually lead to more harm. And we've seen that in you know countries which have banned certain drugs as well. Someone said prohibition. Could you maybe expand a little bit more on that? So what do you mean by that?
I think there was an act in America in like the 1920s that like banned alcohol, and a lot of people found like different ways to try and get alcohol, and they were using like they were tunneling it and they were transporting it through like underground tunnels. So it became like more of a commodity, and more people were actually getting overdoses from it.
And yeah, I think that links a lot to the point we just mentioned as well. We've seen examples in the past where prohibition doesn't actually work. As someone said here, prohibiting things can make people want, seek, or use them more. And of course, when that's not regulated officially, it can lead to increased harm, increased danger, toxicity. The dosage isn't regulated. People will be, you know, there'll be a huge black market arising, and that can have economic consequences as well. So yeah, I think we've covered quite a lot of points here. Stella, do you have any more that you know you'd like to add? No.
No, I think the idea of prohibition and the idea of food was really, really interesting, because it said, should there be a total ban on alcoholic beverages? And someone said in the chat, you know, we don't ban food because it can cause obesity, but we don't ban it. I think the slight difference is that alcohol doesn't actually have any health benefits as such, whereas food, you know, we need it. It's a complete survival necessity. But I do see your point that in excess, everything can be dangerous, and in moderation, it should be okay. The idea of prohibition was quite interesting as well, because I think that comes with anything, that as long as anything is controlled or suppressed, people will find a way around that. And so making it legal might make it, you know, controversial, obviously, but maybe legalizing it could lead to different outcomes. But I think it's a Good idea. Someone said that I think relating to the food point as well, that if they were to ban it, the entertainment economy would decrease. I think the entire point with the food thing, I think the tangent that that person said about the food, because it causes obesity, it's not banned, does have some merit to it, but obviously food is a very, very different thing. You know, you completely need it. And someone said, I mean, you can't ban food ever. It's not possible. You can ban certain types of food, like endangered animals or things which are very, very unhealthy. But you can't ban just food in general. Someone said, I think, sorry, that's it. Cool.
Mhm. And someone said, are there any treatments for addiction? So, addiction is often treated through therapy and, people joining, for example, AA groups, where they receive counseling, they receive help. In terms of drugs, there are some which are being trialed, but there aren't really any mainstream drugs that if you take them enough, that will cure addiction. And in fact, that would lead to its own problems because addict would be, taking more drugs isn't something that would necessarily be beneficial to them. So, there aren't really any treatments as such, apart from just stopping taking the substance. And that is, as we mentioned, very difficult because of the effect it can have on your brain. So yeah, thank you everyone for your comments there. I'll just put up the points we've got. We've got quite a few and a lot of them have been mentioned. So perhaps I'll go through the points on the left and then Sudan can go through the ones on the right. So firstly, why we should ban alcohol. As someone said, it's as addictive as many legal drugs. It can lead to addiction, which is a disease, and that can end in overdose and death. And obviously, alcohol accounts for many of the deaths in this country and also can have a wider range of health impacts too. It's a contributing factor in many violent crimes and often plays a role in physical abuse. And we saw a case study earlier where that was the case. Alcohol is proven to cause serious long-term health problems and is linked to numerous life-threatening diseases, particularly of the liver and kidneys, as someone mentioned. And alcohol addiction whilst pregnant can lead to serious complications for babies, such as fetal alcohol syndrome. So those are just a few of the points that we've got for why we should ban alcohol. So perhaps now we'll talk about the ones we've got for why we shouldn't ban alcohol. So Siddharth.
Yeah, so the points that we came up with for we shouldn't ban alcohol, prohibition doesn't work, as someone mentioned. Alcohol of low quality and safety is distributed in a lawless, unregulated market, which can be very dangerous. Alcohol is an important part of culture around the world, which we mentioned, especially where there's a drinking culture, especially socially. It's quite difficult to ban alcohol as that's quite a large part or quite a significant part of culture gone. Alcohol provides many economic opportunities. Taxes on beer, wine, spirits account for a significant portion of government revenue, and that's probably why alcohol is so expensive. Distilleries and vineyards employ thousands of people. Obviously, you don't want these jobs to go. The economy, quite a significant part of the economy does rely on the alcohol industry. Prohibiting the sale of alcohol puts those funds in the hands of traffickers. Banning alcohol limits freedom. Although thousands of people die every year from alcohol and alcohol-related incidents, millions more use alcohol responsibly, and this links to their autonomy.
Yeah, so we've got a wide range of points that we've come across here. So hopefully that's allowed you to think about this issue a little bit more, and think about the best way in which we can tackle addiction. I think a balance between the two would be most beneficial. We shouldn't ban alcohol, but we should focus more on measures that can lead to people using alcohol more responsibly. So yeah, that concludes our session today. Thank you very much for attending. Please do contact us on medicaldebate@gmail.com or DM us on Instagram at the Medical Debate. Please do subscribe to our YouTube channel where all our sessions will be, and follow us on Instagram to keep up to date with our future sessions and guest speakers, etc. So yeah, thank you very much for attending and see you again next week.
Yeah, all our sessions go onto our YouTube channel and you can access them there. This one will be there by the end of today, later today, or tomorrow. And you can find the link for that in our bio on our Instagram profile. We've also sent the link onto our Zoom chat, so please check it out. Thank you very much for coming and see you guys next week.